He must get on. We are very late.
Yeah. So I is Giovanni Raffa here? I can't see him because
Yes, I'm here.
I
oh
see him
yes, now
here.
I can see you. So Niveditha, you can go on and interview Raffa.
Thank you.
Unmute yourself, Niveditha,
Unmute
please.
yourself.
Niveditha, unmute
Hello.
yourself.
Yeah, I'm sorry, I wasn't being allowed. Hello, thank you for the lovely session, everyone. It's been really amazing to learn from the masters. Dr. Giovanni, it's wonderful to conduct your interview today. You've had a very decorated career so far. So I guess our first question to you would be, how do you see the role of young neurosurgeons in the coming decade? How do you see their role evolving in the coming decade? What is your vision for us? That is what I would like to ask.
So first of all, thank you very much for inviting me. It's so a tough task to talk after these real legends that have talked before me. So I think in the next decade, the main role of the young neurosurgeon will be to drive innovations and in adopting new technology in neurosurgery. Young neurosurgeons are digitally native and comfortable with integrating new digital technologies, for example, AI, but also augmented reality, virtual reality, mixed reality into their clinical practice and also research activity. Indeed, they will be not, I think, only users of these technologies, but they will be also evaluators, and probably we will participate in the process of developing these new technologies, also helping their seniors in the adoption of this kind of tools like augmented reality, for example, in the clinical practice. This already happened in the past with some game-changing technologies, like, for example, neuronavigation. A lot of young neurosurgeons help their seniors in adopting in their everyday clinical routine the use of navigation systems simply because they were more friendly with computer-based interface. And I think that this will happen also in the next years, during which the young neurosurgeon will help a very important will have a very important role in driving innovations in neurosurgery.
Okay, thank you very much. So you already partly answered my next question as well, but I want to see how you see us changing the world with potentially in the next decade with AI and robotics and with neuroimaging and the various advancements that are there. How do you see that changing basically the future of neurosurgery?
I think that all these technologies will reshape the current landscape of neurosurgical practice, and all this technology will become fundamental in our daily routine. For example, AI will be really important for the decision-making process in neurosurgery because it allows for an easier and faster analysis of big data sets, and that will facilitate clinical research and will also help to easily identify clinical evidence that could serve for identification of algorithms for an improved, safer, and even more effective treatment of our patients. For example, AI algorithms in preoperative planning can help by the analysis of a large database of surgical outcome in predicting potential risk and optimize surgical approaches. Also, robotics will be absolutely important. We already know that they have been introduced in our routine practice, but probably in the next future, we will assist also to the development of advanced, even semi-autonomous robotic system that can be guided by neurosurgeons, thanks also to the development of new system with haptic feedback, for example, thus potentially expanding the possibility to have access to surgical procedure is even from remote. And for example, another important application we are here in the Neuro-Oncology session will be the application of AI to neuroimaging. For example, radiomics is a very important field that is evolving and that could help us, for example, in predicting diagnosis before surgery in brain tumor cases, for example, in predicting the status of the IDH mutation before surgery. That will be really important as a strong prognosticator in the daily routine. Young neurosurgeon, of course, will learn very quickly how to use these technologies and will help also seniors for the introduction of these technologies in the clinical practice.
Thank you very much. That's very insightful. Also, what do you think will be the challenges that young neurosurgeons can expect to face with the changing expectations of the patient as well as the healthcare systems in the future?
Well, I think there will be a lot of challenges in the next decades for young neurosurgeons. First of all, we all know that neurosurgery is a highly demanding field. That demand, coupled with the pressure of rapidly changing healthcare systems, represents a high risk of burnout. Young neurosurgeons should be able to maintain an healthy work-life balance and developing effective coping mechanisms to prevent burnout. Such a balance will be crucial for long-term success and sustainability of young neurosurgeons' careers. And they will also face higher expectations from patients, driven by an easily available information on the web, the famous Dr. Google, and the desire for more personalized and less invasive treatments by patients. So patients will increasingly seek detailed information about their condition, their treatment options. They would like to participate also actively in the decision-making process and expect less invasive and more personalized approach. That will require strong communication skills and adaptability from a young neurosurgeon who should also learn how to use these novel technologies and use these novel technologies to face all these increased expectation from patients.
Thank you. Yes, that is very important advice for us. Communication is something that all of us really need to work on. According to you, how important, I mean, this is obviously a very great forum, but going forward, how important do you think global collaboration and mentorship is important for young neurosurgeons in shaping our careers? Yeah.
Global collaboration is of paramount importance for promoting the careers advancement of young neurosurgeons. So participation to international conferences, exchange programs, collaborative research initiative, sharing knowledge, research findings, and sharing best practice across different institutions and countries accelerates young neurosurgeons' advancement. And also mentorship is very important because mentors can provide an invaluable guidance and support for career development. Experienced mentors can provide constructive feedback on surgical skills, guide research, and offer advice for young neurosurgeons and work-life balance. So strong mentorship is for sure helpful to young neurosurgeons' career advancement.
Thank you. One last question. So how do you think we can contribute to the field or even to global health, in fact, beyond just the operating room, or beyond just, contributing to our patients' lives? How do you think we can contribute to that?
A young neurosurgeon can contribute in different ways in research, for example, because they are more familiar, as we said, with emerging technology and can bring fresh perspectives to scientific research. They can give a good contribution also in education because they can play a vital role in training the next generation of neurosurgeons through teaching, mentorship, curriculum development. Young neurosurgeons are enthusiasts. They have a recent experience, so they are also very good educators. They can contribute to curriculum development, deliver engaging lectures and workshops, and serve as mentor to junior trainees, and they can also foster a culture of continuous learning. Regarding global health, they can also contribute to the global health by participating in international collaboration, providing neurosurgical care in underserved regions, for example, sharing their surgical expertise, training local healthcare professionals, being engaged in telemedicine consultation, and working with the international organization to build a sustainable neurosurgical capacity, especially in low and middle income countries, thus contributing to the advancement of global neurosurgery.
Thank you so much. That's been very insightful, and it's very great to hear from you. And it's been wonderful to have such great talks from everyone. And thank you for your valuable time as well. Thank you very much.
Thank you to you all.
Thank you.
I think we had an
Thank you,
excellent
everyone.
session, and we should just close this session.